We're all here because we care about health for pregnant women, their fetuses, and the newborns. And we know that the road to better health is driven by better diagnosis, treatment, and disease prevention. And all of us are here, and we support our foundation because we think the road to achieve it is through knowledge. Research is not our goal. Research is our tool to improve knowledge that drives better diagnosis, treatment, prevention to improve better health. So we in our foundation support the trainees who are going to not only do it right now, but also continue this wonderful work into the future. And you see here the names of outstanding scholars who have been doing this work and will continue doing this work, with the last two doing currently the research work that we support to be able to attain those achievements and propel forward our field. Now, if you're curious about how our program compares to NIH training programs and career development programs that support other trainees from our field and elsewhere, here are some data from recent NIH publication about the likelihood of success. How many of trainees of career development programs, K programs, either K-12, Birch, Werher, and others, how many of them have received either any what's called RPG, research project grant, or the classical accolade R01 to promote the research? And you can see the numbers for yourself, especially in the right bars. Now, if you look at the success of our trainees, you can see that we've done as well, or sometimes even better, than trainees of the NIH programs designed to promote careers. And our program targets only maternal-fetal medicine clinician scientists who seek to advance knowledge. So as you can see, we've done at least as well, and sometimes even better, than the premier programs offered by the NIH. There's something else that I would like to reflect on that, in my opinion, probably indicates the most important change in how we perceive our field. Our field of maternal-fetal medicine as a discipline, and within it, perinatal biology, and within OBGYN, everything we do for pregnant patients is dramatically changing right now. We see a massive transformative change by realizing that what we do every day for our patients is not only important for the 9 months of pregnancy, not only important for the woman who carries that fetus in that time, the few days after birth. Our field, based on the work of David Barker and others, have clearly indicated that what we do for our patients have a lifelong implication for the disease risk, which means that the health of pregnancy plays a critical importance in the health and wellness and disease prevention for women and also for men who are also born to women. So this is a huge responsibility for us in the field of maternal-fetal medicine to carry the torch of what we can better do for our patients in order to change the course of health and wellness for generations of humankind to come. And what's ahead of us, some examples of what's going to be at the cutting edge of research in our field. You can see for yourself, and how many of us are going to be engaged in this kind of research that will change our practice. Are we going to be able to do molecular phenotyping to truly define perinatal wellness? What about perinatal informatics and how we harness the power of information and computation to enhance our interaction with patients? Can we harness the power of analysis of RNA and other molecules, either free-floating in the blood or packaged within placental vesicles, to be able to inform health by a simple blood test? Can we even think further, and not only about diagnostics, but also take our work into molecular therapy, perhaps even use genome editing in the future to change the course of those destined to have chromosomal and other congenital anomalies? This is on the cutting edge of our thinking right now, not yet translated to clinical practice, but I suspect in the next 5, 10, and 20 years, this is what our scholars are going to be engaged in. This is what all of us as a society should be promoting by donating to our cause, and also by promoting our trainees to pursue scholarly work far above and beyond just the daily practice. So I just want to again conclude by underlying the significance of knowledge to advance health. Women's health is human's health. And what we do in this society is absolutely critical for the future of humankind.